Dear learners, today we will learn about the classification of poisons. According to the nature and the manner of poisoning, poisons can be classified into homicidal poisoning, suicidal poisoning, accidental poisoning, parasuicide, abortifacients, aphrodisiacs, arrow poisons, cattle poison, oedial poison, and stupefying agents. Homicidal poisons, as the name indicates, is the poison administered to another person with the intention to kill. The common poisons used for the homicide purpose are arsenic, antimony, aconite, thallium, organophosphorus compounds, oleander, madar, strychnine, powdered glass, insulin, and rarely other drugs, and very infrequently cultures of the disease germs, as we saw in the Pakur murder case. The poisons commonly used to commit suicidal purposes are potassium cyanide, hydrocyanic acid, opium, barbiturates, organophosphorus compounds, and oleanders. Accidental poisoning is commonly takes place as a result of carelessness of storing the poisons and non-poisonous material together. Quack remedies can cause accidental poisoning, such as incorrect preparation of medicine that may contain the poison. Bites by the venomous animals like snakes and scorpion. Greater uses of chemicals in the industries and for the household purposes can also lead to more incidences of accidental poisoning. Putting poisonous substances in the food containers like paint thinners are used at the carpenter's work. Often they are kept in the water bottle. I did many post-mortem examination where the death happened after the accidental ingestion of thinner, thinking it as a water. So we should keep these chemicals very carefully. Also, sometimes inhalation of vapors through the accident, like that happened in the Bhopal gas tragedy, where methyl isocyanide was inhaled by the most of the employees. Parasuicide, that is the para. Para means near or resembling suicide. It refers to the suicide attempts or gestures and self-harm where there is no actual intention to die. This is mostly done to threaten the relatives by taking a sublethal dose of a poison. Examples are few sleeping pills are taken by the youngsters, or any other poison may be taken by the youngster to threaten the parents if they disallow for the marriage with their beloved ones. It is also seen among the psychologically disturbed persons. Abortifacients means the drug that can cause abortion. Drug or poison that can cause abortion in a pregnant woman are called abortifacients. Usually, most of the irritant poisons irritate the uterus, causing it to contract on ingestion or local application, which can cause abortion. Commonly used abortifacients are aconite, arsenic, calotropis, canthrites, croton, ergot, lead, mercury, oleander, potassium permanganate, semicarpus. Aphrodisiacs are the substances that increase the sexual desire. Aphrodisiac word comes from a Greek word called the Aphrodite. Aphrodite was the Greek goddess of sensuality and love. So, the aphrodisiacs are the substances that increase the sexual desire. Usual substances considered as aphrodisiacs are arsenic, cannabis, canthrites, cocaine, opium, and strychnine. Arrow poisons are used at the tip of the arrow for hunting and to kill enemies. Ideal arrow poison must be poisonous parentally, but it should be safe orally, so that if we kill the prey, then we can consume it for the palatable purpose. So to consume, it should not be orally harmful. But when it is injected or comes in the parenteral route, then it should be poisonous. So the property of arrow poison should be like that. Typical arrow poisons are plant-based: Abrus aconite, calotropis, crotonvile, curare, strophanthus, strychnine are used as an arrow poison. Many times these are used in a mixture form, and that is applied over the tip of the arrow, and that is fired from the bow, and it can kill the prey. Of this prey killed by the aconite and calotropis, croton and strychnine cannot be consumed because these are poisonous orally as well. They can be only used to kill the enemies. Another category of poisons are the animal-based: batrachotoxin, potent cardiotoxic and neurotoxic steroidal alkaloids found in the poison dart frog, genus Phylobates. This poison is collected by roasting the frogs over the fire. Poisons derived from the larvae and pupae of beetles of genus Diamphidia. Another arrow poison of animal origin is the snake venom. Alexander the Great was repelled by the Indians by using poisoned arrow dipped in the Russell's viper venom. Dipping the tip of the arrow in petrifying corpses can also cause the tetanus in the prey. Another type of poison is the cattle poison. Cattle poison, as the name suggests, they are used to kill the cattle of enemies or to obtain the hides. Usually used the poison for this purpose are Abrus precatorius, aconite, arsenic, calotropis, nitrates, oleander, organophosphorus, strychnine and zinc phosphide. Ordeal poisons. An ordeal poison is that which is traditionally supposed to prove or disprove the innocence or guilt of the suspect. It is very interesting that ordeal poisons were given to the suspect accused of the crime, most typically plotters against the kings, robbers or the witchcraft practitioner. If he died, he was guilty and automatically received the punishment. This was the thought behind giving the ordeal poisons. If he survived, he was innocent. The belief was so strongly held that innocent people suspected of an offense did not hesitate to subject themselves to the test. Commonly used ordeal poisons are the Cerebra odolum, also known as the ordeal tree, Cerebra tangin, croton seeds, Physostigma venenosum. Stupefying agents are used to stupefy for robbery or women for sexual assault. For this, some of commonly used stupefying agents are cannabis, chlorohydrate, dhatura. You will be very commonly knowing that in the railway, buses, the robbers use dhatura plant to stupefy or deliriate the person and take out the baggage and their possessions. Now, one of the most important thing you must know is the difference between the ideal homicidal and ideal suicidal poisons. If I ask you what type of poison will you choose to commit suicide, if there is any thought, can you tell? So you will say that it should be readily available and cheaper, and you will not buy a very costly poison to commit suicide. It should be pleasant in taste and it shall not cause much pain during the death. So with such type of poison, you will prefer to commit suicide. If you want to kill someone, then you will not see if it is costly, pleasant in taste or painful to the death. As a criminal, you will think that poison shall not be detected and mimic some natural disease so that it gives time to accused to leave and avoid getting caught, and also it will not be detected by the normal methods and the process, and it will mimic a natural disease. So in a similar way, now we will understand what is difference between ideal suicidal and the homicidal poison. So this table, it should be available easily and freely for suicide purpose, whereas homicidal purpose, it is not the necessity. The cost of the suicidal poison usually should be low in cost. It is not the condition with the homicidal poison. If it is of good quality, then to commit the homicide, criminal may go to of very high prices to acquire them. Color, taste or odor should be pleasant and tasteless in case of suicidal poison. In case of homicidal also, the criminal will try to keep the things colorless, tasteless and odorless, so that when added to the food or other things, it will not change the taste of the food material. Solubility with the food or drink, in case of suicidal poison, it is not the necessity, whereas in case of homicidal poison, it should be easily soluble in the food or the drink. Signs and symptoms should not be there or should be very few. It doesn't matter much in case of suicidal poison, whereas homicidal poison should resemble some natural disease process, as we discussed, so that it will not be detected at a time or the delay will happen. Onset of action, in suicidal person will try that he will die as quick as possible, whereas the homicidal poison, the person will try that it takes much more longer time, so that it gives time to escape the criminal, and also there is no any clue to the investigating agency that he may be the accused. So onset should be slow onset in case of homicidal poison. Antidote, there is no such requirement that there should be antidote for suicidal the poison or not, whereas homicidal poison, there should be no antidote preferably, so that it is sure and certain the person is going to die. Suicidal poison, the person will try that it is highly toxic, whereas homicidal poison, it is not that necessity. Also, the diagnosis from the chemical test should be, will not be much considered in case of suicidal poison, whereas in case of homicidal poison, it should not be detected by any chemical test or method. Death in case of suicidal poison should be painless, whereas homicidal poison, it will not be much of botheration. Postmortem changes may be produced in case of suicidal poison, whereas homicidal poison, postmortem changes shall be the minimal or cannot be detected or nil. So common compounds that are used for the suicidal purposes, as we already talked, aluminum phosphide, organophosphate compound, carbamates, barbiturates, potassium cyanide, copper sulfate, oxalic acid. For homicidal purpose, arsenic, antimony, aconite, thallium, organophosphorus compounds, strychnine, potassium cyanides, these are commonly used for the homicidal purposes. We can divide these poisons according to the duration also. So you must also know the classification of poison based on the duration of the poisoning, as different clinical signs and symptoms will be presented by the patients depending upon the duration of the poisoning. Like fulminant poisoning. Fulminant poisoning means a single massive dose, that is more than a fatal dose of poison, causes death very rapidly without any symptoms. So before the patient complains of any symptoms, death of the patient occurs. So this is case of fulminant poisoning. Acute poisoning is the single excessive dose, that is less than a massive dose or equal to fatal dose of a poison, causes the symptoms. So for every poison, you need to know what changes are produced in case of acute poisoning and what changes are produced in case of chronic poisoning. We will talk the details of these changes in respective poisoning in the further classes. So for acute poisoning, a single excessive or the 1 or 2 doses should be enough to produce the poisoning. Subacute poisoning, it occurs gradually over a period of time, some time, not very longer, taking more time than the acute poisoning and less time than the chronic poisoning. The poison is taken repeatedly in the small amount but over a short period of time. Drug automatism is one of the example of the subacute poisoning, where a person takes the drug over and over again, forgetting each time that he had already taken the dose. This can lead to cumulative overdose and the effect of its toxicity. The well-known phenomenon of drug automatism was hypothesized in case of barbiturates and benzodiazepines. Midazolam causes anterograde amnesia, so the patient may forget if he has taken the drug and takes the drug over and over again, causing the self-poisoning. Chronic poisoning. Chronic poisoning is the very minute amount of poison is taken over a long period. For example, occupational poisoning. Chronic lead poisoning, that is seen in those working in the lead factories, causing the plumbism. Many times the poison arsenic may be given to the victim in his diet over a long period. Do you remember the case of thallium poisoning, where the son-in-law of the deceased was mixing thallium in the food items of the family member for a long period, and they developed symptoms of the chronic poisoning of thallium. Another term is acute on chronic poisoning. In such cases, the patient is primarily suffering from chronic poisoning and acute poisoning occurs on the top of it. It mostly happens in the cases of chronic drug abuse cases, when one day the victim inadvertently takes more than the usual dose. In my observation, those chronic poisoning cases where the patient dies suddenly mostly happens because of the acute poisoning over the chronic poisoning. Another important term is the secondary poisoning. Poisoning results when one organism ingests or comes into contact with the another organism that has been poisoned. That means secondary poisoning, that is, object that has been eaten is not actually poisonous, but it was already poisonous, got poisoned, and someone else ingested that object and he got poisoned. That is the true interval of one intervening object is there to produce the poisoning. The good example is the Minamata Bay disaster. Minamata is a small city on the coast of Shiranao Sea in Japan. In the mid-1950s, the villagers of the village near the coast of Shiranao Sea of Minamata started to notice that their cats were behaving strangely, especially falling into the sea. Some people even believed the cat's behavior was an act of suicide. Soon after, villagers started to report unusual symptoms like numbness in their limbs and lips, difficulty hearing or seeing, tremors in their arms and legs, trouble walking, brain damage. Like the cats, some people began acting strangely and shouting uncontrollably. Something was affecting their nervous system. This was the diagnosis of the doctor. But the question was what it could be. As the leading food of the villagers and the cat was fish from the sea, scientists suspected that fish in the Minamata Bay were being poisoned. So here what is the decision? That the fish is being poisoned, and normally fish is not a poison, but eating those fish is causing poisoning. So here fish is getting poisoned by something, and because of the eating the fish, the person is getting poisoned. So this is an example of secondary poison. So this fish was the common thread between them. In July 1959, researchers from Kumamoto University discovered the source of illness as the high level of mercury in the in the blood of the cats and the residents. So they named this condition as the Minamata disease, that is the poisoning by the mercury. They found that a large petrochemical plant in Minamata run by the Chiso Corporation was suspected of being the source of mercury. It was later estimated that Chiso Corporation had dumped 82 tons of mercury compound into the Minamata Bay. As the mercury dumping continued over the time, poisoned people gave birth to the babies who were also poisoned. The children were born with severe deformities, including gnarled limbs, mental deficit, deafness, blindness. The fishermen of the Minamata began to protesting against the Chiso Corporation in 1959, demanding that the company stop dumping toxic waste and compensate to the villagers for the illness linked to it. Still, Chiso did not stop poisoning Minamata waters till 1968 due to inadequate measures by the government. According to the Japanese Ministry of the Environment, as of 2013, almost 3,000 people had been certified as Minamata patients. By this time, more than 2,300 had died. In April 2001, the Osaka High Court determined that the government's Health and Welfare Ministry should have started taking regulatory action to stop the poisoning at the end of 1959, when the researchers had concluded that Minamata disease was being caused by the mercury poisoning. The court also ordered Chiso to pay the plaintiffs $2.18 million in damages. On October 2004, the Supreme Court of Japan ordered the government to pay 71.5 million yen in damages to the Minamata disease victim. The Environment Minister wrote in the apology to the plaintiffs, after 22 years, the plaintiffs achieved their goal of making the people responsible for Japan's worst case of industrial population pay for their negligence. In 2010, Chiso was ordered to pay 2.1 million yen and monthly medical allowances to the people who were not initially certified by the government as having the condition. More than 65,000 people applied for this compensation, showing that over the 5 decades later, the effects of the disaster was still being felt. This is a whole case of secondary poisoning where the fish were poisoned by the direct intake of mercury from the industrial dumping into the sea, and humans got poisoned eating those poisoned fishes. Another good example of secondary poisoning is the doctors or any other staff can get secondary exposure to poisons during the organophosphorus poisoning or the sulfose poisoning treatment. For sulfose poisoning, it is said that even inhalation of sulfose can be fatal to the examining doctor or the assistants. They are those who are helping in the examination of the patient. Even those patients that are living either and also while performing on autopsy. So the doctors or examining assistant shall take proper precaution while examining such persons. Now coming to the classification based on the symptoms. This is one of the important way to classify the poison. For the better understanding of the subject, I will suggest you that you memorize this particular classification. In this classification, according to symptoms, the poisons are categorized into basically 4 groups: corrosives, irritants, systemic poisons, and the miscellaneous groups. In the corrosives, further they have been categorized into the strong acids, strong alkalis, and metallic salts. Corrosives are those poisons that cause corrosion of the body wherever they are exposed. They can be strong acids. Under the strong acid, inorganic and organic acids. Inorganic, sulfuric acid, nitric acid, hydrochloric acid. Organic acid, carbolic acid, oxalic acid, acetic acid, salicylic acid. They can be strong alkalis, sodium and potassium hydrates and carbonates, sodium bicarbonate, sodium hydroxide, potassium bicarbonate, carbonates, potassium hydroxide. They can be metallic salts, zinc chloride, potassium chloride, ferric chloride. Then comes the irritants, which causes irritation to the surface of exposure. Under the irritants, we have inorganic, metallic and non-metallic. In metallic, arsenic, lead, mercury, copper, zinc, thallium. In the non-metallic, phosphorus, chlorine, bromine, iodine. In the organic poison, we have vegetable poisons, castor oil, seeds, croton oil, madar, semicarpus anacardium, calotropis, capsicum, aloes, abrus precatorius. In the animal poison, canthrides, snake venom, insects, scorpion, spiders. And in the mechanical, we have powdered glass, diamond dust, chopped hair, and many other large list of mechanical poisons are there. We will talk and learn each poison individually in the respective classes. Another classification is the systemic classification. Here in the systemic classification, the systemic groups is the poison acting on the particular systems of the body. In that poison, the poisons acting on the nervous system are called the neurotoxic, acting on the cardiovascular system, cardiotoxic. Those acting on the respiratory system and the blood are the asphyxiants. Again, under the neurotoxic, they are classified into the cerebral, spinal and the peripheral according to the action on which they are working, like those acting on the central nervous system, that can be of three types: CNS stimulants. The example include amphetamine, caffeine, cyclic antidepressants, methamphetamine, methylphenidate, modafinil. CNS depressants, that includes the alcohol, anesthetics, hypnotics, opioids and sedatives. Deliriants can be belladonna, cannabis, cocaine, datura, ioscimus. Further, the spinal poison like the nux vomica and gelsemium that acts on the spinal cord. And those acting on the peripheral nervous system are the curare and the conium. Cardiotoxics are those poisons that act on the cardiovascular system. The list include aconite, quinine, digitalis, oleander, nicotine, antiarrhythmics, immunoglycosides, macrolides, general anesthetics, and hydrocyanic acid. Asphyxiants are those poisons that cause a deficiency of oxygen for utilization of the tissue. It includes the gases like carbon dioxide, carbon monoxide, hydrogen sulfide and coal gas. It also includes cyanide. And then under the miscellaneous groups, we will learn about the food poisoning and the agrochemical compounds. Food poison by the various can be of the infective or non-infective origins. Under the agrochemicals, we will learn pesticides, insecticides, organophosphates, carbamates, organochlorine compound, bipyridal herbicides, paraquats and diquat, chlorphenoxy herbicide, bromoxynil, loxinil, rodenticides, zinc phosphide, strychnine sulfate, sodium monofluoroacetate, fluoroacetamide, fumigants like aluminum phosphide, ethylene dibromide. We will learn the mechanism of action and detail of all the above poisons in respective classes. Another classification of poison can be according to the use. So, poison causing abortion, abortifacient, poison used to stupefy, stupefying agent, cattle poison to kill the cattle, arrow poison, aphrodisiacs and others. We already talked this list of poisons under the classification of poisons according to nature and the manner of poisoning. Another way of classifying the poison can be based on the organs that are affected by the particular poison. Under that, Poisons affecting the hematological system, that is the bloods, affecting the bloods, anticoagulants like warfarin. Poisons affecting the immune system, immunotoxic agents, immunosuppressive drugs can be the second one. Hepatotoxic agents are those poisons that are affecting the liver. They may be remembered by the mnemonic hepatic, hemolytic poison, ethanol, HE, ethanol, P, paracetamol, A for aflatoxin, T for toxaphene, I for iron, C for chlorpromazine. So, hepatic are the hepatotoxic poison. Another is the nephrotoxic poison, that is poison affecting the kidney, renal system. So, they can be further categorized into the poisons causing the glomerular injuries. So, they can be cocaine, quinine, conjugated estrogens, gold compounds, NSAIDs, penicillamine. Poison causing the PCT necrosis, proximal convoluted tubules necrosis. So, they can be remembered as a mnemonic like approach MAG mom, approach MAG mom. A for aminoglycoside, P pigments, phenol, radio contrast, approach radio contrast agent, O for organohalides, approach A for anti-neoplastics, C cephalosporins and other beta lactam antibiotics, H for halogenated alkenes, approach MAG mom, M for myoglobin including hemoglobin, A for anesthetics, G for glycols, MAG mom, mycotoxin, MO mycotoxins, O for organohalides, M for metals, includes the various arsenic, cadmium, mercury, lead, iron, zinc, chromium, uranium. Another category of poisons can be poisons causing distal convoluted tubules necrosis. So, that can be cisplatin, amphotericin and glycols. You may remember CAG, cisplatin, amphotericin, glycols. Poisons causing crystalluria. So, poisons causing crystalluria can be acyclovir, ethylene glycol, sulfonamides. If you know the importance of these things are that if a person comes with a crystalluria, so your mind should go that there could be the certain poisonous substance that he has been ingesting. Ethylene glycol poisoning is one of the common presentation in the clinics. Another category can be the general nephrotoxic agents like NSAIDs, ergot alkaloids, prerenal failure cases, nephrotoxic agent, heavy metals, rhabdomyolysis causing drugs, oxalic acid, chlorates. This can be remembered by the mnemonic nephro, N for NSAIDs, E for ergot alkaloids, neph, P for the prerenal failure, H for heavy metal, R for rhabdomyolysis causing drugs, O for oxalic acid. Pulmonary toxic agents can be there, those drugs that are affecting the lungs like chlorine that causes the bronchitis, titanium causes hard metal disease, silica causes silicosis, phosgene causes the pulmonary edema, cholinergic drugs causes the bronchoconstriction, paraquat is the often asked in the multiple choice questions as well, causes the acute pulmonary fibrosis, and it is one of the common in the those working in the agriculture sector. They present with the acute pulmonary fibrosis as a result of the chronic paraquat poisoning. Another system is the CNS toxic agents that we already talked, classification based on the symptoms. Those who are CNS stimulants, CNS depressants and the deliriants. Another could, and also the spinal and the acting on the peripheral nervous system. Another category is the CVS toxic agents. So, there we talked aconite, oleander that we already saw in the classification according to the symptoms as above. Another is the agents, dermatotoxic agents, that is the agents that cause the damage or to the skin. So, they can be arsenic, that is the carcinogenic, camphor causes photoallergy. Corrosives, chemical burns, as we already talked, it causes wherever the corrosive is given, it causes the corrosion and that can cause chemical burns. Fluorochromarines, phototoxicity, industrial solvents, they cause allergic contact dermatitis. So even those patients who are coming with the certain skin conditions, skin problems, the poison history of the toxicity, history of the exposure to the foreign chemicals should be taken. Agents affecting the reproductive system are the alkylating agents that affect, alkylating agents affect the gonadogenesis. Chlorphenoxyherbicides affect the spermatogenesis. Plasticiders affect the testicular toxicity. So even though those cases of infertility and the many other problems they are presenting, there can be addiction also of certain drugs and the exposure of these agents as well. Agents affecting the endocrine system. Those of the different endocrine system may be affected by certain drugs like acrylonitrile that causes damage to the adrenal cortex, atenolol that causes act over the adrenal medulla, aluminum affects the parathyroid, calcitonin causes the damage to the pituitary, thyrouracil to the thyroid glands. So by knowing in this way, this is very helpful for the clinical purpose. The last important category of classification is based on the toxidromes. Toxidromes is the constellation of signs and symptoms of a toxin or poison, that is most of the poisons show a common set of signs and symptoms. Like the adrenergic toxidrome, here poisons like amphetamine, decongestant or cocaine will produce an adrenergic excess type of sign and symptoms, that is the increased respiratory rate, heart rate, temperature, blood pressure, dilated pupils and others. That is all the features of the stimulation of the adrenergic receptors. So such groups of poison that are otherwise totally unrelated are categorized under the 1 toxidromes. Similarly, anticholinergic toxidromes, cholinergic toxidromes will deliver the cholinergic features. In this way, at present, we are able to divide all the poisons into 6 to 8 categories, like adrenergic toxidromes that will produce adrenergic type of signs and symptoms, anticholinergic toxidromes, cholinergic toxidromes, opioid toxidromes, sedative hypnotic toxidromes, and serotonin toxidromes. Also, snakes are under the separate toxidromes. The benefit of classifying like this is tremendous, as presently for the management of poison, it is very tough to have an exact known source of poison. So in that case, we have to treat the patient symptomatically. This approach is very beneficial as we manage the patients according to the particular toxicodromic features. This approach is very helpful in the clinical setting. We will discuss the detail of this toxidromes and also the toxidrome approach of the management of poisons in the detail in the coming classes. So with this, thank you so much for today.